So the credibility of the research findings that you have when you reach your data analysis after you're done with your proposal. A proposal has chapter 1, chapter 2, and chapter 3. Then we have to collect data using the data collection instruments like questionnaires and surveys, and you start analyzing the data. At this stage, you're going to use SPSS and other important tools. Now, the trustworthiness or credibility of those findings will depend on validity and reliability of the instruments that you choose to use. So as researchers, you must ensure that the tools that you are employing will accurately measure the intended constructs, which we call validity, to produce consistent results, even if they're repeated over time. That is what we call reliability. Reliability is simply the replicability of results. Usually give an example of a scale. In the morning, the scale gave you 15 kgs, afternoon 15.1, evening 15 kgs, then you'd be sure that it's reliable. But if you're going to test is giving you outliers, 15 kgs, 21, 9, then you know there's something wrong. So we want to also see how that your researchers, even if they're replicable, they'll give the same. So we're going to look at validity and reliability. So to understand this, we're going to look at some key insights. What is validity? Validity is simply the degree to which an instrument truly measures what it intended to measure. Okay, so it ensures that the conclusions that you draw from the study will accurately reflect the reality of the phenomenon that you want to understand. So there are two types
I don't
of
know
reliability.
if it's just
Is that a question?
I was saying you're breaking. We can barely hear you. I don't know if it's just on my end.
Am I breaking the other people?
I, I can hear you clearly.
No, you're not breaking.
Okay, I'm clear.
Okay,
Okay.
then it's fine. Okay.
So when want to talk about validity, we're looking at the degree to which the instrument that we are using will truly measure what it is intended to measure. So it will ensure that the conclusions that we're going to, from the study, extract will safely, in reality, be a true picture of the phenomenon that we want to understand. So there are several types of validity. We have what we call content validity, construct validity, criterion validity, face validity. Okay, and the others are the tests. So when we're dealing with content validity, basically we're looking at validity that ensures that the measurement tools will cover all relevant aspects of the construct. For instance, a questionnaire that you want to use to measure academic performance. So for us to ensure that it has content validity, it should include items that should look at whether we are assessing knowledge, skills, whether they are cognitive abilities rather than just other dimensions. So a questionnaire must also must embrace this aspect of the content. So content validity typically um, is assessed through self-judgment. Okay, are we together? Construct validity. Then when we go to, that's content validity. Okay, that is content validity. Any questions so far? And when you go to construct validity, what are we talking about? When you go to construct validity, what are you talking about? So construct validity basically looks at validity that measures or determines whether a test truly measures the theoretical construct for which it was intended. For instance, if you want to test the intelligence, it should correlate with other types of intelligence tests. So this can be assessed using what we call factor analysis to determine underlying dimensions. So that is what we call construct validity. So in construct validity, we want to measure whether the test or the test instrument would truly measure the theoretical construct that it was intended. So this kind of validity is very important for abstract concepts that are not directly observable, like intelligence, motivation, self-esteem, you know. So you are establishing construct validity, and here it involves you confirming that these two aligns with the theoretical framework that accurately measures the construct that it was theorized. So if a test is designed to measure intelligence, it must therefore demonstrate a strong correlation with other established intelligence tests that are also intended to measure similar constructs. So, for instance, if a test doesn't correlate with these other measures, it will raise doubts whether it is truly assessing intelligence. So, construct validity is assessed using unique factors like factor analysis. So, this factor analysis will help you identify whether the test or the two measures the intended construct. For instance, a scale of measuring depression. You can evaluate that by checking other emotions, like the cognitive, the behavioral aspects of depression. So a strong construct validity will help you effect that. Then this is what we call criterion validity. It is a validity that measures the tools that correlate with external criteria. So we're looking at criterion validity. It measures how well a test correlates with the external criterion. Okay? It includes what we call predictive validity and concurrent validity. So it's an important test because it helps determine how well the instrument will perform in the real world or how well it will predict an outcome. So the predictive validity is a subtype which helps you assess the tool's ability to predict the future outcomes. For instance, SAT scores, they are often used to predict the future academic performance, like the CS. Okay, so for a CS, sometimes you will be able to tell that this person, how did they feel? The CA was good. Okay, so these scores are an indicator to showing how a student will perform at your final exams. Then we have what we call concurrent validity. This is a subtype also, which is used to compare the two with other established measures taken at the same time. For instance, if you are doing a new test on depression, may be compared with a widely accepted interview to determine how well it correlates with the existing methods that are already accepted. So if you have high concurrent, so concurrent means in agree. If you have high concurrent validity, it means the test is concurrent, the same. So this is construct validity. So by validating this instrument tool against an external criteria, researchers can assess that it's useful in the real world. We also have what we call face validity. Face validity. This is refers to a superficial appearance of validity. So here you want to test whether the instrument appears in brackets to measure the supposed measure. It is based on a causal inspection. So it's unlike these other forms, the face validity doesn't involve rigorous statistical expert analysis. It is actually based on how the instrument seems to people who are using it, such as researchers or participants. For instance, a questionnaire asking questions about physical health. It might include questions like exercise, diet, medical history. Okay, so if participant or researchers feel these items are missing, then just know that, okay, this is not, So face validity, of course, is not one of the big scientifically types of validity, but it plays an important role when we are dealing with the participant cooperation. Okay, so these are types of validity. Then we go to reliability. Any questions before I proceed to reliability?
Just kindly go over the content validity. I missed it a bit.
Okay. Content validity. What did you say about content validity? We said it refers to the extent to which the tool represents all components of the construct. Content validity. Where is it? Okay, here it ensures that all the measurement tools they cover all aspects of the construct. So in this regard, what we mean by content, we're looking at the extent to which the measurement tool will represent all the facets of the construct it is intended to measure. So it includes or it ensures that the tool covers comprehensively all relevant dimensions of the concept, leaving uh, no critical areas overlooked. So it's a type of validity, especially important in subjective assessments, where the construct being measured is complex. So, for instance, if a researcher is using a questionnaire to measure academic performance, so content validity here would ensure that the questionnaire will assess the range of factors that will influence academic success, like knowledge, skill, cognitive abilities, rather than just focusing on one area. So if the instrument will lack a well-rounded assessment of these relevant domains, it may provide an incomplete or biased measure. So content validity is evaluated through expert judgment, where the subject matter, in this case, the expert will review the instrument to determine if it covers all aspects of the construct. That's what content validity is all about. Okay, so
Okay, so are you able to give me an example maybe of what consists the construct?
okay, an example of what?
Or maybe like a construct. So the saying is ensure the measurement and to covers all relevant aspects of a construct.
Okay, so if I were to repeat myself in a layman's language, I said
Mm-hmm.
content validity looks at the extent to which a tool, and the tool in this case, we're looking at a test, a survey, or a questionnaire. So the extent to which a questionnaire will accurately represent the entire range of the concepts or the content that it was meant to measure. In simpler terms, it's about ensuring that the item or the questions that are included in the questionnaire will cover all the relevant aspects of the construct. The construct is simply a concept or a trait that you want to measure in research. It is often something abstract that cannot be directly observed or measured. So constructs could be theoretical underpinnings, or they represent things like intelligence, motivation, anxiety. All these are constructs. So researchers will develop these measurement tools or indicators to observe or infer the presence of these constructs. The constructs, for instance, job satisfaction is a construct. Okay, so content validity will measure the extent to which the questionnaire will accurately represent the range of concepts or content that will measure the construct, the tool that we want to measure. So it's about ensuring that all the questions included there are relevant to the subject matter without omitting important dimensions. So, for instance, if you're creating a test to measure math ability, so content validity will ensure that all areas of math, like algebra, geometry, are adequately represented in the test. So, content validity ensures that all parts of the construct are represented. A construct is any underlying trait or concept that is being what? Measured. Are we together?
Yes, it's clear. I couldn't just get a clear distinction between that word in the definition of content validity and the
Mhm.
way it's used as
As another.
validity.
Okay,
Yeah,
that's good. Okay, so
yeah.
uh, so now, what is construct validity? In simple ways. Um, so when you're dealing with construct validity now, we are looking at the degree to which the tool actually measures what it's supposed to measure. So it's about making sense of the questions, in short, or the items on the test. Do they truly reflect the concept that you're trying to assess? For instance, if you're measuring stress, the test should ask questions that actually relate to stress, not unrelated to stress like happiness or physical fitness. So construct validity will ensure that the tool accurately captures the right thing. Okay. So what is the difference therefore between content and construct? Validity. Huh?
Um, I think for
Just to help
content,
you, when you're dealing with these two,
sorry.
just to help you quickly, of course, both of them are a measurement tool that I use to measure what is supposed to, as opposed to other aspects. So when I deal with content, it focuses your tests covering a full range of the concept. So it's about making sure that all topics or all areas related to the construct are included in the test. We are dealing with math ability, so content validity will ensure that you include all questions to do with algebra, geometric, or it doesn't leave on. Whereas construct validity now discusses whether the test truly measures the theoretical concept. In this term, the concept is a construct that is supposed to measure. So it actually ensures that the test is actually assessing the construct like stress, intelligence, motivation, and not something else. So if you're testing stress, construct validity will ensure that the test measures like anxiety and not unrelated things like physical health are included. Okay, quickly, without going too far, we will look at reliability tests. So what is reliability? So what is reliability and what tests refer to reliability tests? Okay, what is reliability and how is it important? If I want to answer that question quickly, then we close just 15 minutes of time. So when you're dealing with reliability, looking at the consistency or dependability of the tool that you're using. So a reliable instrument will yield stable, repeatable, and consistent results over consistent conditions. So reliability is very important because it ensures that the results do not become random errors or inconsistent. So there are several types of reliability that we need to look at. There's test, retest reliability. From the term test, retest, it can give you an idea that this is a kind of measure that we use when we uh, want to measure stability over a test period of time. So it will help you assess whether the measurement instrument will yield consistent results when administered to the same group of people to different time points. So this type of validity or reliability is very important for tools intended to measure stable traits of behavior like personality or aptitude assessment. So if you're dealing with a personality test, it is administered to a group of people. That test again re-administered to the specific time interval of maybe a month. If that instrument is good, there should be high retest reliability. It means that the results are highly similar. The limitation for this is that some external factors may influence your results over time, like mood, learning. Okay, your perceptions may change because maybe you are now a graduate, So time aspects may affect the two results, your response 10 years ago and now. Then we have what we call inter-rater reliability. Inter-rater reliability. This one assesses the degree of agreement or consistency between different raters. The term rater is like the observer. So when they are assessing the same phenomenon, so this is a type of reliability in situations where judgments are made. So like we had the Concord sit on similar issues, then the raters had different judgments. Okay, so one to look at is their high consistency with inter-rater. So it's a type of reliability which is critical in situations where subjective judgments are made, like clinical diagnosis, performance evaluations, behavioral assessment. So in a clinical setting where two doctors independently evaluate the severity of the symptoms of your child, If there's high inter-rater reliability, it would mean that both doctors will give you the same results. So this will indicate that, well, their conclusion is the same. But if this one is telling you that um, you have uh, typhoid, the other one is telling you this is malaria, then there'll be a question. So inter-rater is very important because it ensures that the measurement tools um, are not biased or influenced by individuals in their differences of their learning. Qualitative research, they are important because subjectivity of the observer should not introduce a larger variability. When we go to internal consistency reliability, internal consistency reliability. Are we following? Am I clear?
Yes, you are.
Okay. So internal consistency reliability examines the extent to which two different items on a test to measure the same underlying construct. So this one is used to assess whether all items in a measurement tool are consistent with one another and that they reflect the same concept or idea. So this type of reliability is very important when evaluating tests that consist of multiple items like surveys or questionnaires. So if you have a psychological scale designed to measure depression, so if items on the scale, for instance, are questions about sadness, loss of interest, hopelessness, all correlate with one another, it means the scale will demonstrate internal consistency, meaning all items consistently, when assessed, will give you the concept of depression. They need to move, they need to correlate. So this is usually used when we have the comeback alpha. In SPSS is what we're going to look at, which helps you test um, internal consistency. It indicates reliability of a set of items. So the comeback alpha, if it's greater than 0.7, it means that your your thing is generally acceptable. Okay, it's acceptable. Above 0.8, 0.9, strong internal consistency. So a high level of internal consistency means that items are appropriately designed to measure the same concept. So if you have low internal consistency, it will indicate that the tests are poorly aligned and other items are unreliable. Lastly, what we call the split half reliability. Split half reliability involves you dividing a test into two halves, comparing the results of both halves to determine if they are consistent with each other. Okay, each other. So split half, although it's not very much use, so it involves you splitting into halves and comparing the score to determine whether it's internal in themselves. Are we moving together?
Yes, someone has asked a question in the group. Since is unable to.
What instrument are you referring to? You have mentioned reliable instrument. So instruments, in this case, we're talking about a questionnaire, a data collection instrument, a questionnaire, a survey. Those are the instruments we are dealing with. Okay? Are we together? So research instrument, the instruments we're talking about here, um, um, these research instruments. Is that clear? Okay. Okay, those who are still in the baby class, we'll talk about these instruments in the other classes. I'm sorry, I overlooked that. I'm using some terms that I talked about. Okay, so it goes back to according to Shuttleworth and Cobb, evidence-based practice includes part in implementation, the findings of well-constructed quality research studies. So being able to critique quantitative research is an important skill for researchers. Consideration must be given not only to the result of the study, but also to the rigor of the research. Rigor refers to the extent to which researchers worked to enhance the quality of the studies. In quantitative research, this is achieved through instrument measurement of validity and reliability. Validity is defined as the extent to which the concept accurately measured in quantitative study. For instance, a survey designed to explore depression, but which actually measures anxiety would not be considered valid. The second measure of quality in quantitative studies, reliability or accuracy of the instrument. In other words, the extent to which the instrument consistently has the same results if used in the same situation on repeated occasions. Explain the main types of bias that threaten reliability and validity. Analyze challenges of using standardized questionnaire. Explain ways in which reliability coefficient in research can be increased. Okay, so maybe that's where I was going to now. So bias um, in research is common. Okay, so bias is inevitable. Now we're going to look at the different types of bias and how they affect validity. Okay, we're going to look at the different types of bias and how they affect validity. The term bias, what does it mean to you? So when you're dealing with the term bias, bias simply is an error or systematic error that may distort or skew the true findings. So these errors can occur at various stages in research and will affect your validity and reliability. So, of course, while validity refers to the accuracy of the measurement too, of what it intended to measure, reliability also looks at the consistency of the two in stable environments. So bias will introduce inconsistency. It may also lead to inaccurate or unrepresentative data. So we have different types of bias which will affect validity and reliability. So we have what we call selection bias. Selection bias occurs when participants of a sample are not representative. So this is a type of bias that occurs when certain groups are over or underrepresented in a sample. So this may lead to inaccurate results. So for instance, if the survey conducted income levels of participants from wealthy neighborhoods and the results showed that in Kalingalinga, I found people getting more than 5,000. Then I make my assumption that everyone in Lusaka gets that's selection bias. So selection bias would threaten external validity. External validity is actually the ability to generalize findings to a larger population. So when the sample doesn't accurately represent the target, then conclusions may not be very applicable. That's what we call selection bias. So we also have what we call measurement bias, which arises when instruments do not accurately measure the intended variable. Now, under measurement bias, we are looking at the research instruments like surveys, the tests, and they don't capture our intended measure. So it often affects the results from poorly designed question instrument like a questionnaire because of inaccurate calibration. So you need to be careful as you come up with the questionnaires. For instance, when you have a survey of a question that is poorly worded, it may lead to confusions or misinterpretation. For instance, you're asking people how often do you exercise without providing specific time frame. Is it per week, per month? So it will lead to varying interpretations. So measurement bias will reduce construct validity. Remember construct validity, validity of a test that measures what is supposed to measure. So whether the test actually measures what it's supposed to measure. And it also affects criterion validity, which tells you how well your test correlates with the other external factors. So inaccurate measurement will lead to a distorted or unreliable data and may fail to represent a phenomenon under investigation. So we also have what we call observer bias. Observer bias is one kind of bias that uh, occurs when the researcher's expectations influence the data collection interpretation. So this is often made by students who want to assume the results must tally with what they think. So this bias happens in the subconscious unintentionally, especially when you're convinced of a certain notion. Okay, maybe this government is the best. Even in clinical trials, the doctor may diagnose a patient with a severe illness due to what he supposedly thinks is, from face value, a root cause. So this bias actually comes in to affect internal validity because the accuracy of the study in terms of causal relationships become what? Distorted. It also affects reliability, which is internal consistency. So when the observer's subjective views will influence the assessment, so meaning the objectivity of the study is compromised. So how do we mitigate such biases? Researchers must employ blind assessments where a person collecting data is unaware of the hypothesis. So this will reduce the risk of the subconscious influence of the results. We also have what we call response bias. Response bias is a tendency of participants to provide inaccurate or dishonest answers. Okay, there's a question. Um, the notes will send in the paid up group. Okay, so response bias occurs when the participant answers questions dishonestly. So this happens when we, in a survey, we're doing maybe a survey on alcohol consumption. So most of the people don't want to look like alcoholics, abusers. So they avoid certain information to avoid social stigma. So questions involving drug use, sexual behavior, participants will be hesitant to provide truthful information. So response bias will undermine construct validity and can distort conclusions. How do we mitigate this? To reduce this, researchers should be anonymous. Anonymous means they should not be known by name or in an interview. They should be confidential to help participants truthfully answer the questions. Additionally, indirect questioning must be there. You ask questions randomly. Okay. Then there's, lastly but not the least, attrition bias. Attrition bias happens when the participants drop out of the study in a random manner. So this one often happens over time, where participants who drop out, okay, or a non-response. So it's a type of bias that can distort our findings of some studies or trials, as a final sample may no longer be representative. So they drop out of the study, drop out at random. Okay. So, for instance, you're dealing a long-term clinical trial. We are bringing new medication. Participants who experience side effects may more likely drop out. Now, this may lead to what is called a bias sample. So, those who remain in the study might more likely experience positive effects than, So, it's called attrition bias. So, bias will affect external validity. It reduces generalization of findings. It also poses a threat to internal validity. So how do you reduce this? You reduce this by tracking participants and employing statistical techniques to um, ensure there is intent to treat analysis where you include all participants in the final analysis, even if they drop out. So we usually have challenges in using standardized questionnaires. Okay. So challenges of using standardized instruments in research, it's like questionnaires. So standardized instruments are pre-designed test instruments that are used to measure variables. So these ones have an advantage because they're reliable. They are valid measurements. They also come up with set challenges, like they're time consuming when you're selecting. Um, So standardized instruments are pre-tested design instruments of variables that consistently are used over time. They have challenges. They're time consuming, they're cultural differences, they're costly, they lack flexibility and data complexity. In terms of time consuming, when selecting or adapting standardized tools, they can be time consuming because the validation process, including testing of the instruments, reliability, relevance, and test, it takes a lot of time. So researchers need more substantial time for these cultural differences. So standardized instruments sometimes may be developed in a cultural society that may not apply like to Zambia for questions um, that may not align to our setting. They're costly. And these other factors you may read on your own. Okay, so with this being said, I would want you to go through this question as your homework. I've sent you the solutions on the group. I want your solutions also to come through. Thank you so much for your time, and we'll meet in the evening.